the nice thing in our job is this relation with patient. And the important thing that if we love our patient, when I go to work, I'm thinking about that I'm going to meet a group of people that I love them. And whenever you feel that you are loving someone, the patient will feel you. He will feel that you, and he will exchange these feelings with you. And really, this gives me very, I'm satisfied. I feel satisfied with my job, and I feel very happy when I sit with any patient and talk to him, and I feel that he is satisfied. Just if he thanks me, even if I got no incentive on this job, on this extra job, just this thanking from the patient, it's give me the satisfaction, and I feel happy. And I never feel that I'm stressed with overwork or over.
Never. So this happiness helps you to sustain yourself when things are busy, tough.
Whatever I'm busy, whatever, but this feeling always it gives me the satisfaction, because I'm satisfied just to feel that my patient is happy, is satisfied. This gives me the satisfaction. Although in my country we have no such incentives for GPs really.
What country are you?
From Iraq. Okay. And the discipline of family medicine, it just have been introduced for the last 10 years in my country. So it is newly introduced really. And we have no such incentives for family physician. And sometimes we maybe our incentive is less than other specialists. Yet, what gives us the satisfaction, it is more than it is the moral part of our work really, of our job. It may give us satisfaction. It is more than the incentives and the financial.
You must share that with others. More. Would you like
I've forgotten all about thinking of the patients that make you happy because work. I was on the previous workshop here, which was about art, implementing art in general practice, music, art pictures, and poetry. And we were told to write about a person that we didn't like, or made us angry. First of all, we had to write our version, and then put ourselves in the other version. I've had to do that to someone like that. That made me happy. I suddenly remembered when I was a young doctor, just come out, and there came this 83-year-old lady in and said she had vertigo. And she started by presenting that she'd been to sort of doctor this and this at the hospital and the big and she, I think she met about 25 doctors. I said, "What are you doing here?" I thought. And I said, so I had to start somewhere. I said, when do you get dizzy or when do you get vertigo? I said, in the morning when I do my gymnastics. I said, just show me. Now, I didn't know at that time she was an old belly dancer, and she was almost blind, and she just stood up. I can't do it. I said, and then I get dizzy. I thought I'd take a breath. I said, could you sit up on the what do you call it? Couch, that's right. And it was a bit high. So you jumped backwards at 83 years old. I said, something reminded me of that. And that really does take a lot of stress out.
Excellent. Would you like to share something?
I actually thought this is about rapidly changing medical practice.
Yes.
I'm not really finding the sort of the subject. That's very amazing stuff, but not really finding what is this. I was thinking this is more about more computer incorporation into medicine and that sort of thing. So
No.
yeah, I wish if you can give me a recap of what is happening.
Would anybody else like to do that?
Yeah, it's about burnout. Work-life balance, really.
Preventing burnout.
I think all of
Minimise-
us are practically at risk of burnout.
Yeah.
The only place perhaps I worked for 3 weeks as a locum in Queensland, Australia, was this occupational physician who would finish up the clinic on Fridays an hour earlier, and they would have like a beer break. Everything I was part of the like
I worked in that clinic.
He's a character. I was that soldier.
Dr. Peter Fenner is a great person. He has written books on jellyfish, special kind of jellyfish that he has found, and this is the only place I've found that like they may have less risk for burnout, but perhaps everywhere else I have worked, we don't have any time to scratch our head. It's hardly I get any lunch break.
Well, tell me how people sustain themselves through hobbies. Hands up who has a hobby. I really would like you to share your hobby with people in the room. This is quite fun sometimes. What hobbies do we have in the back row? Just listen.
I've been dancing for many years, still dancing.
What sort of dancing?
Jazz, you know, the stuff you did in the 80s?
Stuff you did in the 80s.
Yes. I was born in the 80s. I know 60s as well, 60s.
Forgiven. Any nice hobbies here or interesting or strange?
Well, it's not that strange, but I go scuba diving, and especially when you've had a couple of stressy days with patients talking a lot, and it is so quiet down there.
So you immerse yourself in deep water. Anybody else in the back row?
I bake bread and bring it into work. If I'm really stressed, I beat out the dough and so it's a bad sign when I bring cinnamon buns to work.
Excellent, excellent. Any other hobbies?
I train horses, trotting horses. I'm actually, I have an amateur license since we have 2 kinds, professional and amateur. Now I'm a licensed amateur trainer, trotting horses.
Lovely. And here? You've lost your hobbies. Yes. Now maybe you can
I have
answer.
twins.
We will say no more. Obviously, you're a busy lady. Maybe time to think about reviving an old hobby or starting something new, just to help sustain you. From the twins as well. Yes.
Oh, I like to look at TED Talks. I don't know if you know technology, education, design, and I do that on my elliptical machine, so it gets me to exercise. And so there's always a new talk that is amazing, so I find I get a lot out of that. So.
We've got 3 young GPs here.
I'm not that young. It's very kind of you. In the 80s. Yes. No, I actually have a research post. I would say that that's both a source of stress, but also a source of escape, because it's a very different kind of job. And it doesn't really necessarily involve, I mean, I tend to do secondary research, so reviews and things. It doesn't involve seeing any human beings necessarily for long periods of time. Which is great, because I don't like data collection. I think it's a very time-consuming process. When you do data collection, I can sit in my clinic. But I was just going to just make a little observation, because I'm listening to all your things. So this in itself is a very de-stressing thing. So coming along to things like conferences and actually hearing and things like, I had we used to be called the Young Practitioners Group, but we're not anymore. So we're now the self-directed learning group, because we've all got older together. So that's a sort of a commonality, so it's a bit like sort of Skype, but it's a sort of face-to-face version. And all of us actually have mixed research stroke GP service jobs, so that's one aspect. But also, it seems, one of the things I was listening to is, it doesn't seem as if necessarily the patients are the problem. Yeah, sure, patient workloads are a problem. but it's the admin we have to do that's the problem. And maybe that's the new burden. I mean, certainly working within the health service in the United Kingdom, which is where I am, it's endless. It really is utterly endless. And seeing the patients is, you know, you may have a 3-4 hour clinic, but it's at least another couple of hours of stuff afterwards. And if we were going to push back against anything apart from protocols, which I completely agree with, and frankly, I think it doesn't matter what words you use, really. They're just a form of bullying.
Yeah.
It's a form of abuse.
Yeah.
It's an abuse of power, actually, is the reality. It's an abuse of power and authority and control. So that's probably what we should be trying to push back against. Not patients, because, you know, they're in fact potentially on our side. They're the people we could call upon to say, do you realise I will see you, and then I will have to spend probably another 10-15 minutes making sure I code it properly. You know, stuff like that. And you know, if there's movement, I think that's where the movement is. It's, you know, against unnecessary admin. Some admin is always going to be necessary. We just have to accept that. And I love this idea. I have this very similar idea about the lady from Iraq there. But you just have to find something that you like about the patient. Just one thing. It could be anything. But most of the time you can find something you like about them. And that way, it doesn't seem so bad when you talk to someone you like. It's just someone you absolutely detest. You can stand the sight of. So.
Thanks for that contribution, thanks.
Well, I used to do judo before, and that was really great because the physical exercise really strong. But now, I must admit, I feel a little bit guilty when taking time only for myself, like stealing the time from my family or from my patients, and I cannot decide what's right. Like in the nail between the stones, and I don't know how to get out.
May I offer a contribution there? Because that's really important, and I say this to patients. If I take on board self-denial as the currency, it means that I tell my wife and my children, that's the way we do things. It's self-denial. If I take time for myself, it sends the message, this is what we do. You take time for yourself, patients take time for themselves, and that's healthy. So it is a gift to your family to claim time for yourself, because otherwise you cease to be the person your wife fell in love with. And then she loses you.
You can put it very simple. It's just like when you're flying and they tell you the rescue procedure, put on your oxygen mask on yourself before helping others. And this is what we all need to do.
And keep dancing.
I want to be the 80-year-old ballet.
And judo on Monday. We're getting really short on time. It's 1 minute left. So could I just have a couple of hobbies thrown out and maybe a background?
I'm big into sports, but just to share a very quick 30 seconds, a patient died in the surgery, first time ever since I qualified 33 years ago, patient same age as myself, and it was very stressful, and unfortunately the patient didn't come around after being shot. So I closed the surgery, sent everybody home, sent staff home, and I was down to play a golf match. So I went and I played my golf match and we won. So it was just interesting how I was basically hit the ball straight after seeing that poor man die.
Yeah.
Yes, great.
I picked riding motorbikes for the last 12 months. I'm finding it very relaxing, and like I really appreciate my wife's support, because when she sees like that I look tired and not really in the mood, she just tells me, get out, get on the bike, and you'll be better, and that will happen. Yeah.
Excellent, excellent.
I'm a volunteer in the Senior University in Portugal, and I spend a lot of time organizing some meetings with the rest of
Portuguese
residents.
Trainees, excellent.
Yes. And we have our own group.
And in that group, what do you do?
We do scientific meetings. We discussed some administrative problems that come up during our practice. We do weekends together.
Lovely.
Yes, good.
Yes, we organize workshops.
Yeah.
Yes, it's
So you're getting strength from each other.
Yes, our biggest difficult is to bring another colleagues to our meetings because we in Prague,
We're practically always the same.
yes.
But we keep trying.
I think if you keep going as you're going, they will want to be part of your group, so well done.
So yes.
And I think the most important point, I think, that I can just summarise it is that if we're going to sustain ourselves through our careers, it's us that has to make the effort. We have to do something. It won't happen through wishful thinking or hoping that somebody else is going to change it. We have to do something proactive and active about it. And I think I might just leave it there.
Another thing is knitting. That was cute. I saw two ladies sitting in the board giving ceremony and really knitting. That was very cute.
Yes, that's good. Thank you very much for your participation.